So my name is Chris Hall. I work in the Center for Excellence for Interprofessional Education. I'm also the obnoxious person running around taking pictures of you during these events, so I appreciate your forbearance. Welcome to today's IPEC event, which we hear from Portland Defending Childhood. As you know, childhood exposure to violence can have long-term damaging effects on health, learning, and behavior across the lifespan. And our event today is intended to increase your understanding of those effects of childhood exposure to violence and share some specific strategies to prevent and reverse the long-term impact of violence on children. So I think this is very clearly a healthcare issue, and many of you will encounter clients whose stories you don't know, but may come to fruition in their bodies in various ways. And this is a way to help you have a lens on what might possibly be their complaint. The University of New England was recently awarded a HRSA grant, which is a Health Resources and Services Administration grant, federal, big money, nearly $1 million over 3 years to provide stipends to social work students, to engage parents and child care providers and other primary caregivers on advisory teams to inform integrated behavioral health teams who work with at-risk children and youth in Maine's underserved rural and urban communities, because the underserved are not just rural, but also urban. And I'm going to point out someone who works on that grant, Nicole O'Brien. And how many social work students do we have here today? Raise your hand, high and proud. One. Thank God you're here. 2, we have Lauren Martinez. Please take the mic and talk a little bit about it so that everyone will know.
Hi everyone, I'm Nicole O'Brien, and I helped write the grant that we received. We're really excited at the university to have this grant. And if you know of any social work students who might be interested in applying, it offers a $10,000 stipend for them to help with tuition. And we hope to provide some great training in the future. We're actually going to have Portland Defending Childhood come back in December, which will be free training, and we invite everyone to join for that event. And then we'll offer some future trainings along with this Catch Me grant. So if you have any questions, feel free to ask them.
This, however, is not just an issue for social work, which is why we're glad you're all here. I do want to introduce Barrett Wilkinson, who is an MPP, which stands for Master of Public Policy, from Portland Defending Childhood. And that organization is part of the City of Portland Public Health Division. And she'll introduce her team. But this team was recently presented the Public Health Program of Excellence Award by the Maine Public Health Association at its annual conference in Augusta. So this is hot and happening stuff. Barrett is going to share her work as the prevention coordinator at Portland Defending Childhood, and I hope that you will give her a warm welcome.
Can you all hear me? Is it allowed to not use the mic?
The mic is for the video.
Oh, okay. That's what I was afraid of. Okay, well, I'll just hold all of these things in front of you. Good afternoon. Thanks for coming. We are going to give you the best overview we can in about an hour around childhood exposure to violence, the prevention, intervention, and treatment. I have with me some of my colleagues, Dory Hacker, who is the clinical outreach coordinator for Portland Defending Childhood, so she's going to help me talk about this issue with you today. And then Siad Ahmed, who is one of the community health outreach workers, and I will later explain the partnership with the community health outreach program and Defending Childhood. The introduction covered most of this, but Portland Defending Childhood is one of 8 sites funded through the U.S. Department of Justice on the issue of childhood exposure to violence. So the outgoing Attorney General, Eric Holder, decided when he became Attorney General, he really wanted to figure out what he could do about the issue of childhood exposure to violence. And so Portland, Maine was selected as one of 8 sites to receive a significant amount of funding to do just that. So we're sort of a pilot site to inform what can happen throughout the rest of the US. All of the sites do this work differently, but we certainly have a lot of common threads. And getting to talk to students from many different disciplines is really exciting because you're going to go out or are already working in all sorts of fields that involve children. And so our topic today is going to be relevant in lots of different ways. Dory and I will leave time at the end for questions and we can have some discussion, but given our short time frame, we'll try and move really quickly through the information, but very welcome to conversation. So, I forgot to say that the Defending Childhood Initiative is unique in that it's a partnership between the City of Portland Public Health, where I work, and Maine Behavioral Health Care, where Dory works. It's really about the partnership of prevention and intervention services, so children's mental health treatment and public health prevention. And so we all really come together on this issue, but it's a very unique collaborative in that way that we get to work with two big organizations on this topic. So today we're going to give you an overview of the issue of childhood exposure to violence, give you some ideas about what it means to work with kids, really in the context of kids who have experienced violence or trauma, what that can look like, and how to build their resilience. And make sure you know that there are resources available in this community to deal with the issue of childhood exposure to violence. So we'll show you this slide again at the end because it's really important. We want to emphasize self-care when dealing with issues of trauma. The impact of trauma on kids is great, and it's very significant. And for those of us who work with kids, it can have an impact on us too. You're entering a number of fields that work with other people. You're not making widgets. And so taking care of yourself while caring for others is essential. While the issue of childhood trauma and exposure to violence is pervasive, what we also know is that children and people, all of us are very resilient, and so we have the capacity to heal after traumatic experiences. So we have a great deal of strength. And that support and supervision, no matter what your role is, no matter what field you work in, seeking support is essential. So, why are we talking about trauma? Why were we invited here today to speak to you, UNE? The reality is, as I said, many kids have lived through traumatic experiences, and kids bring those experiences into the work that you will be doing with them, whether it's in social work or in healthcare fields, which is a very diverse field, so there's a lot of different ways you could be interacting with children. And what happens to kids affects us too. That's why we're talking about this issue. How many of you have heard about the ACEs study? None of you have heard about the ACEs study, except some faculty. Okay, so I sincerely hope this is not the first time, not the last time rather, that you hear about the ACEs study, because it actually is just the beginning of many studies that help speak to the pervasive nature of trauma in our lives. So the ACEs study was done more than 10 years ago at Kaiser Permanente Healthcare in California, and it was done on a very middle-class sample, but a huge sample. And what they did is they looked at experiences of adults when they were children and sort of made a tally of how many adverse experiences adults had, and then looked at what the life outcomes were for those adults. And as it turned out, the greater number of adverse experiences that these adults had as children led to poorer health outcomes, higher risks, and any number of other incidents. So this comes from the ACEs study, this pyramid. And it's a little hard to see. Their graphics are a little tricky, but at the top you have early death. So adverse experiences, the more you have, the more likely you're to have multiples. I'm very much oversimplifying this study. You should look it up. You can Google it, and you can add up your own ACEs. It's not a current study, and there's been a lot of things that have come since that help even better explain the reality of what happens to us as children affects us as adults. So that's why the ACEs study is important. And this study was really, I think it was important because it helped make that link from, well, this traumatic experience happened and it was an emotional event, But the reality is there's a leap to the health of someone long term, because someone who has more ACEs is more likely to engage potentially in risky behaviors, and it's affecting growth and brain development, as we're going to get into shortly. So the ACEs study is very, very important, so I really encourage you to look up that and then all the research that's happened since. So trauma. I think it's a word most people have some familiarity with, and these are just some basic definitions that you can refer to, but I think the important thing to remember is that trauma is about an overwhelming event. It overwhelms our ability to cope. Dory, I can't remember when you're jumping in. Yeah, you tell me when. I'm going to go through these. As I said, an overwhelming experience. That's right. Okay. Something that is typically, it overwhelms us, and it is a threat to our physical or mental well-being. And that's going to be very different for every person. That is based on our own individual experiences and our histories of trauma, certainly. It leads to a profound sense of vulnerability and helplessness, and it really can challenge our beliefs about the world. And so for children, what this can look like is also very diverse, and what it means to impact their belief system about the world can look any number of ways. Generally speaking, we think about two different types of trauma. So simple acute trauma, which could be a car accident. It's a one-time event, and not that it can't cause a traumatic response for someone long term, but that it's more of a one-time event. And then chronic or complex trauma, which is what we would think about with like domestic violence. So a child who's living in a home where there's domestic violence is exposed repeatedly and ongoing to, all sorts of events, whether or not they're directly physically hurt. They may be hearing it, they're living with it. That's an example of a more chronic or complex trauma. This is not an exhaustive list, but a list of some of the different types of trauma. So I'm sure we've forgotten some, but you can see the diversity of things that can cause trauma. So when the funding and when Defending Childhood happened, they did a major survey in the United States and discovered that 60% of children are exposed to violence or trauma in their home, school, or community in the United States. So 60% of our kids under 17 experience violence. That's a significant amount of our population. And the Maine kids count data, so to get a little more local, lets us know that 25% of kids in Maine have experienced 2 or more ACEs. And that is above the national average. We do know in Maine we have disproportionately high rates of domestic violence, but there are certainly other types of violence that kids are experiencing. In Portland in particular, which is why I introduced you to Siad from our community health outreach worker program, is we know that folks coming from other countries as refugees and immigrants or asylees are seeing maybe different types of trauma. For any number of reasons. And with 90% of the refugees that live in Maine living in the greater Portland area, this is definitely something we're trying to work on and make sure that the information and resources we can provide through Defending Childhood and the treatment options that are available for children are accessible to everyone, no matter what language you speak or what country you come from or your immigration status. So we've had a very significant population shift in Portland in particular and the greater Portland area. So, and we know that those kids are more greatly exposed to trauma as a result of war, or perhaps even the process of coming to the United States. So Portland Defending Childhood has partnered with community health outreach workers who are essential members of the community, who are leaders in different communities, who speak different languages of the refugee and immigrant populations. And so we are working closely with them. So sometimes we do these presentations together. We try and do outreach within individual communities for that issue as well. So just a little bit more about local stats. So Dory's you're gonna listen to Dory now, not me. And we'll go through a little bit more about the biology of trauma and let Dory take it away.
This might be the first time I've ever spoken with a microphone, so I apologize if I put it down and forget. So I have a question before we get going, because I know that it's in the afternoon and I like for people to feel like they're a little bit engaged. And does anybody here like to go camping? Can you raise your hand? Okay. I just want you to imagine for a moment that you just woke up on a beautiful Maine summer morning. You're camping, couldn't be more gorgeous. The lake is completely still, and you're just sort of taking it all in. And then I want you to just for a second imagine that you've got like a raging grizzly bear running towards you. I just want to ask you what you think will happen for you within your body in that moment, and feel free to shout it out. Run, okay. Where's your gun? What was that? Fight or flight? What does fight or flight feel like in your body? Has anybody had an experience where they've been startled or in a car accident or something like that and they had a fight or flight response? What does that feel like? Yes? Exactly. What else? Nausea. So, what was that? Sweat? Yeah. What we're talking about here is a stress response. And sometimes a stress response can become so overwhelming that it transitions from stress into trauma. But a stress response is something that every individual is familiar with on some level or another. And everybody's body responds slightly differently depending on their history, their temperament, and we're going to talk a little bit about that. But there's a physiology that happens under stress that becomes acutely important under trauma when children are exposed to trauma. So we're going to talk a little bit about that. One of the things that I wanted to talk about too is in those moments when you're being charged by a grizzly bear, are you able in those moments to do things like remember your aunt's birthday? Or think about a list of things that you have to do that day? So our brain has this really cool thing that it does, and we're really glad that it does, because the truth is if a grizzly bear is coming at us, we don't really have time to think through our 10 options that we could do. Okay, maybe I could jump in the lake, maybe I could run up that tree, maybe I should go back in my tent, I'm not exactly sure. To have a critical thinking experience in that moment would take way too long, and our body knows that, and it completely bypasses our capacity to critically think through the situation, and it makes a decision immediately on its own. That fight or flight is a very adaptive thing that happens. So fight or flight is not in itself traumatic, and it's not in itself a bad thing. So I'm going to start with a video. And this is going to talk about the difference between stress and toxic stress.
Learning to deal with stress is an important part of healthy development. When experiencing stress, the stress response system is activated. The body and brain go on alert. There's an adrenaline rush, increased heart rate, and an increase in stress hormone levels. When the stress is relieved after a short time, or a young child receives support from caring adults, the stress response winds down and the body quickly returns to normal. In severe situations, such as ongoing abuse and neglect, where there is no caring adult to act as a buffer against the stress response stays activated. Even when there is no apparent physical harm, the extended absence of response from adults can activate the stress response system. Constant activation of the stress response overloads developing systems, with serious, lifelong consequences for the child. This is known as toxic stress. Over time, this results in a stress response system set permanently on high alert. In the areas of the brain dedicated to learning and reasoning, the neural connections that comprise brain architecture are weaker and fewer in number. Science shows that the prolonged activation of stress hormones in early childhood can actually reduce neural connections in these important areas of the brain at just the time when they should be growing new ones. Toxic stress can be avoided if we ensure that the environments in which children grow and develop are nurturing, stable, and engaging.
So in this video, it's talking about there are options even after a traumatic experience that can build resilience. You know, they show the picture of the teacher sitting down and helping that child regulate and getting back into that inner connection. And we're going to talk a lot about resilience as a part of this. Sometimes I'm defective when it comes to my mousing, so excuse me for a second. Okay. But what they were also talking about is toxic stress. When it's ongoing, when it's chronic, it can change our biochemistry, it can change the way our automatic responses happen, so that even a smaller amount of stress can trigger a strong stress response, and oftentimes disproportionate to what's going on. And we use the analogy of a sensitive smoke alarm. I don't know if any of you have been in an apartment or a house where the smoke alarm goes off every time you boil water. Sound familiar? I'm seeing some smiles. I grew up with one of those and it drove us crazy. It was like, oh God, we have to do all these different things in order to make spaghetti. But in these moments, this is when the thinking brain, for people who have been overexposed to stress, their thinking brain shuts down and their doing brain kicks in. So I spent 5 years as a director of a residential program with kids who had been exposed to toxic stress and trauma throughout their lives, had been raised by the system. And I had a teenager who I worked with who stayed with us for about 6 months before she started to feel comfortable sleeping with the light off. So her capacity to feel trust and feel safety was really compromised by her upbringing. And when I think of this sensitive alarm system, I think of this one day where she was just not in a resilient place. She was supposed to go to her primary doctor for an annual doctor's appointment, and the cab that was picking her up was late. And she started to imagine her doctor being angry at her for that. And that turned into such a strong stress response that no amount of reasoning could de-escalate her and get her back to a sense of safety and calm. It became so escalated that we ended up having the ambulance come. And so that's a very extreme example of a sensitive smoke alarm, of a child who has been really through the ringer, who needs to build up some of those resilience. And even at that point, it's not too late, and this is a girl who ended up having a tremendous amount of success. So one way to think about this is, and this is a way that if you're working with families, this is a way to sort of describe this phenomena with individuals that you're working with. And it is going to take maybe Barrett being my person, because I can't do it all. Okay, so this is a model of your brain.
You have one too.
Yeah. Here's your brainstem, and here's your inner reptilian brain and your emotion regulation, and these two work together. But they're all monitored by your frontal cortex. So your frontal cortex, which is all your capacity to reason, your affect regulation, your ability to think your way through things, that's all here. And what happens when you have a stress response is sometimes it can go up and sometimes you can flip your lid. And it's a great, an example and a model for kids. And in fact, you know, they talk about sometimes kids can go up to the teacher and say, "Are you flipping your lid right now?" There's an imagery that's involved in that. And truthfully, kids like the science of understanding how their stress is working. So hi Mala. So when we're going to talk about some strategies. What we're looking to do is to bring our lid back down. Thank you, Barrett, for your demonstration skills. To bring the lid back down. And the truth is we want to do that for ourselves too. We want to be in the best possible place when we're interacting with kids so that we have all of our faculties in place and we can help them get there too. So how children respond to trauma can be very different depending on the child, depending on their age and development, and their developmental stage, on their temperament, their perception of the actual danger. When we were talking about the definitions of trauma, we're talking about the experience of the individual. So one way to think about it is the trauma is not in the event, it's in the experience of the event. So the perceptions of the dangers faced, did one individual think it was life-threatening and the other person not think it was life-threatening, and so therefore did they have a different physiological response in that moment? Did they feel less helpless or more helpless? Their own trauma history, so there can be cumulative effects. Adversities that are faced following the trauma. So I can think of an individual where I worked with where the child and mother were in a car accident, and then the adversity following ended up being even more stressful for the child, in which the mom had a brain injury and was less available to the child. So that's not a fight or flight experience, but is much more dysregulating for her as an individual. Availability of adults who can help, reassure, and protect. And that's where everybody in the community comes in, as we all have an opportunity to be one of those available adults, even if it's just for 5 minutes in a stressful moment. And then cultural beliefs. That can be defined by a family, a community, or a country of origin. There's family cultures around what is a good or a bad thing. So common reactions that we might see in infants would include attachment difficulties, the ability to connect and attach and lean into their parents, or an anxious attachment where they don't ever want to leave their parents because they don't feel that they can manage themselves. The inability to self-soothe, the child who just can't settle down when they're upset. Their stress mechanism isn't turning off. It's not slowing down, even if you're doing all the right things. Now, if any of your parents, that any child can have a moment where they can't soothe themselves, and that doesn't necessarily mean they're having a traumatic response, but it's something that you would want to look for as your parents are talking to you about, I'm worried about my child, this is what I'm seeing. So in a pediatric setting, you might even, for young children, see headaches, stomach aches, regression in their toileting, depression, anxiety, tantrums. And none of these things point a definitive finger towards trauma. And I want to be, really clear that one doesn't necessarily mean the other. But these are the kinds of things you want to keep an eye out for, and consider asking questions about what kind of scary or stressful things have happened for that individual. Common reactions you might see in school age are also regressive behaviors, physical complaints, nightmares, things that we've talked about. But you may also start to see things like low self-esteem or aggression in a classroom. Coping mechanisms in one scenario where it's a strength, in another scenario can look very differently. So one example I think of is a little boy who might do something very smart in the moment when his parents are starting to fight. He goes and runs in his closet to keep himself safe. And in that moment, that can be a really effective coping skill. But what kind of things come into the mind of teachers when a child is running out of the classroom and hiding in the hallway in a closet somewhere? What thoughts might come up? What frustrations might come up for the teacher? Attention seeker, playing games, not listening, those kinds of things. So then they start to get identified as having behavioral issues at this age, that sometimes the underlying problem can be trauma. And then adolescents can have all those things we've already talked about, all the way from the attachment to the inability to self-soothe and the behavior problems. But adolescents often do have an increase in risky behaviors just as a part of their normal developmental stage. This can become much more acute for children who've been exposed to ongoing toxic stress. One of the things that we also see that's not on this list a lot in adolescence is perfectionism. That general sense of, I cannot be off the line in any way, because that could mean some form of danger, somebody deciding to not love me or somebody deciding to hurt me. Running away, truancy, anxiety, depression, poor self-esteem are all things that we see. So we like to give analogies because I think those are the things that stick. So if you've got somebody coming into your office and they've got the hoodie and the black eyeliner and they're swearing and I don't want to be here, what are some of the judgmental things that might come up for somebody who's working with this kid? What was that? They're into drugs? Yep. Oh, and a troublemaker. Thank you. On Monday, I was here 2 buildings over, and the examples that came up were lost cause or punk. What a punk. We would like to think that we wouldn't have those judgments, and many of us are able to sort of see under those behaviors. But those are some of the things that come up for these individuals and maybe have in several other environments. So they may be sort of prepared for you to make those same assumptions about them. But what might be underneath those experiences can be a full set of thoughts, experiences, feelings, and core beliefs. So when you start to think of this individual and then you hear their backstory and you hear that they've had 10 foster placements kick them out, they've had teachers sort of put them over in a corner and ignore them while they're teaching the rest of the class because they haven't really invested in this individual. And when you start to think about that and the fact that they're showing up and giving you an opportunity to help them, even if it's from a very defended, I don't want to be here kind of place, then we might also be able to remember some of the other qualities that they're utilizing from within themselves to show up and give an opportunity, and what are the things that we can do to bring that out for them. Another way to think about it is that invisible backpack. So kids walking in and they've got those core beliefs. They have beliefs about who cares about them, who doesn't, beliefs about the world. And every person has that, every child has that. It's just about whether they're positive beliefs about themselves or scarier beliefs about themselves. We talked about the physiology of toxic stress. Here are some quotes from some children. The source of this is the National Council of Juvenile and Family Court Judges. I'd be really miserable. I used to have these pains. People said they were stress or something. I stopped breathing. I used to get really upset and cry a lot. I was a 13-year-old. The 16-year-old says, it was the worst part of my life, constantly being shouted at, frightened, living in fear. You'll never know what it's like thinking that every day could be your last. So trauma isn't just a bad memory that comes up and it stresses you out. It really can be a new normal that comes in to how we interact with the world. But we want to be really clear, and we're going to talk more about that we really have to balance when we're doing this work, partly for our own self-care, but also in how we interact with the children that we work with, is that while we can acknowledge that there are negative outcomes for trauma, that children are really resilient and they're really strong and their brain is still developing. And there is room and time and place for them to experience successes. They may have gone through something severely traumatic and still be functioning pretty well. And with statistics being what they are, we probably know a lot of people in our lives who have been through significant trauma who are functioning incredibly well and having strong relationships of love and connection. And so we also need to remember that that's not the end of the story, and that resilience can be built before a traumatic event that allows them to be more able to handle the stress in the moment, but it can also be built after and even during stressful experiences. Barrett's doing some incredible work in the school, public schools right now. I think there's 72 classrooms who are utilizing a prevention model for building resiliency in kids in the grade school system. Is this you? Okay. Let's give this to you.
Okay. All right. So the backpack metaphor is a helpful one because we want to start to think about what it is we're putting in the backpack. What are we doing to help bolster resilience and help add to the protective factors for kids? So there's some research on this, of course, and I'm going to oversimplify given the duration of our time together today. Is that when they've looked at kids' resilience factors, the number one biggest protective resource is a caring adult in their lives. And so even kids who experience really scary, traumatic things, do really well when they have an adult who cares about their development, who's paying attention to what their needs are, and who's there to help calm them down, even if they can't control what's happening in the world altogether. So, what can we be doing to repack that invisible backpack? To help kids see themselves as important and worthy and help them have positive beliefs about the world. So we'll probably come back to a lot of the things we can do to build safety. In Defending Childhood, we spend a lot of time thinking about what are those strategies, like what does that mean to build resilience for a kid? So it's about the way we interact with children, how we control ourselves, and it's also about what we can do for them. We'll skip over talking to parents, because I want to talk about resilience, because I'm the prevention coordinator, and that's like my home base, and that's what I get really excited about thinking about. So I really like this definition of resilience about it not being only the capacity to heal and thrive under stress, but the ability of a community to come together to make sure kids have what they need. It's about shifting our frame from focusing about what happened to someone, what happened to a child, to what buffered them from those things that went wrong. That's what resilience is really about. There's another video from the Harvard Center on the Developing Child. They've done a really good job of taking this topic and summarizing it, so I recommend you check it out. The Brain Hero is a little bit longer video, but it's a very good one. Again, Harvard Center on the Developing Child. We really like their resources. That was the same video Dory showed you on the biology. The good news is that we are biologically resilient too. So I started out by telling you, the long-term health implications and early death related to adverse childhood experiences, which can be, that's a pretty dark picture for all of us. But as Dory was saying, child brains and adult brains, for that matter, have the ability to grow and heal. So these are two of my favorite terms that speak to that. For those of you who are in science fields, I think these are good terms to know. Neuroplasticity and neurogenesis, which means like it's still growing, it's still changing, and there is hope there. So the number one protective factor is, we summarize by saying it's a safe adult. It's one caring adult, it's a safe adult in the life of a child who can really make a very big difference. But I don't think it's quite enough to just say, like, oh yeah, every kid should have a safe adult. Every kid should have at least one caregiver who really is tuned into them and paying attention to what they need. So, but what does that mean to you? What do you think it means to be a safe adult to a child of any age? Yeah. Brilliant. So an adult is a role model and someone who can show children how to regulate their emotions. Absolutely. Brilliant. Other ideas? What does it mean to be a safe adult? Yeah. Absolutely. Someone they can trust with what they're feeling, how they're feeling it. Absolutely. Yeah. So someone who helps them feel not alone. Yes. You guys are great. That is all perfect. Yeah. Stable fixture in their lives. Yes. That's really, kids do thrive on routine and knowing what to expect, and so that can be very helpful, part of being a safe adult. It looks different for different age kids, but the themes are going to be very much the same, and all of those things you said are true of what it means to be a safe adult. So when we think about resilience and we think about all the places kids go as they grow, when they're in a childcare setting perhaps, or even just with their family, when they enter school, when they become involved in the community, even as children and as young adults, and the family, what are the messages we want kids to be hearing from adults? And it's what the first person said when I said, what does it mean to be a safe adult? Like, it's someone who can help show them that the world is a hopeful place, and adults shouldn't, be using violence. And if something traumatic happened to a child, that it shouldn't have happened, but that the adults are there to help and are resources. So when we talk about prevention and what it means to prevent childhood exposure to violence, it's a very big concept. And so this slide is how I've really boiled down very big things, because I want to be hopeful about it, because I have to believe, doing this work, I have to believe that it's possible for us to prevent violence. And that starts with believing that it's not inevitable. So yes, 60% of kids in this country are exposed to violence in their home, school, or community. That's a lot of kids. And in Maine, more than 25% of kids are experiencing 2 or more adverse experiences. And when you look up that ACEs study, you're going to learn even more about what those adverse experiences are. However, all of us are not walking around traumatized, and 60% of kids are not leading, traumatized lives and all of the negative outcomes that can result. So we have to believe that violence is not inevitable, and there's things we can do about it. What we know about violence and how we deal with it is a result of cultural norms and attitudes, and so we have to be part of shifting that. We have to define that. We have to decide what is acceptable and how we want to be with children. So when you enter, you're in school, many of you now, when you enter the workforce in the various fields you will, what role do you want to play in the lives of children in your work life? For those of you that are parents, how do you define those norms for your children, for your family? If you work with children in other capacities, all of us really have the ability to be safe adults or be people who support safe adults. So, perhaps your role is working with parents. So how are you a safe adult? How are you a resource to a safe adult in the life of a child who needs it? It's really small steps. I'm taking this big picture thing and I'm thinking about it in really small steps, but that's what it requires. It requires a lot of really small steps. Now, certainly, cultural norms and attitudes can also be added to by policies and laws and all of those things, and that too helps shift the culture of violence and changes what we think is acceptable. Life skill development is also, it was mentioned in everything that those of you responded when I said, what is a safe adult? That's life skill development. Life skill development is a primary prevention strategy. So says the World Health Organization, among many, many others. So life skills are a lot of different things, but kids who have good life skills and good social and emotional competencies are less likely to act impulsively. They're more likely to be able to ask for help when they need it and to keep looking for help if the first person they go to doesn't give it. Kids who can identify their feelings are more able to recognize others' feelings and work through things that are happening to them. This is not certainly all of the life skills that relate to prevention, of course, but this is some of them. So, these, they're all important. They don't exist alone. We kind of need to keep building these as we grow. It isn't like, okay, I learned how to listen in first grade, so I'm good. We have to keep learning new levels of listening. We have to keep learning new levels of empathy, and that happens, as we grow and even into adulthood. So there's certainly a lot more to that conversation. When it comes to issues of trauma, and especially working with kids, of course, it matters that we are patient, because everyone is going to experience everyone is going to react to experiences of trauma and violence differently. The amount of time and the ways they need support is going to look different. And change happens slowly. Changing this stuff, this happens slowly. This happens ideally throughout the course of our life and development. So, of course, that's going to require patience too. And especially for kids who, had challenges early on, they're going to need more patience. And that's going to take a lot of our effort too. So, Dory, I don't know if you want to come back up.
I'll just do the treatment options.
Yeah. Sure.
So, and please excuse us, we found out that even though this is an hour-and-a-half presentation, that most of you have to leave at the end of the hour. So you notice that we sort of skipped through about a half an hour's worth of slides regarding secondary traumatic stress, which is something that's really important to keep an eye on in your career. And when we come back for our half-day training on the 5th, that will be something that we discuss. And no matter which role that you're in, being exposed to children and adults who are going through very stressful situations, especially in the medical field, can take a toll. And we strongly recommend that you always have a place in your profession where you have a supervisor or colleagues that you can debrief and take good care of yourself. It's really important to put your own oxygen mask on first, to have self-care when you walk into your job, to have self-care when you walk into the office of that one client, take some deep breaths, all of those things, and we would go into much more detail about that. But the other thing that can really help you in the work, no matter what profession, is knowing what your resources are, the things that you don't have the capacity to do. We did this with police officers also. Oftentimes police officers are walking onto a scene and they want to be able to help the family in a way that they are simply not at liberty to do in that moment, because they have to worry about all the legalities and protocols and procedures regarding the actual crime that's occurred. Knowing that they can say, there's resources for you and here's where they are, is very important. So no matter where you land in your profession, we really want you to know what the resources are around you, to come up with your own little cheat sheet about what are the domestic violence shelters, what are the sexual assault places, the Department of Human Services, what are treatment options that you can offer. Here in Portland, we have 3 very effective evidence-based treatment models that are being provided by many clinicians here in Portland, and it's just really good to know that they exist. So you may not remember what all of these are, but to remember that they exist and that you can contact us at Portland Defending Childhood and we can guide you to where those are and remind you what they are. But trauma-focused cognitive behavioral therapy is one of the most researched trauma treatments for children that I'm aware of. It is very extensive and very effective, working with children and their parents and learning how to deal with that new normal, to shift their normal back to something that's feels more safe. There's child and parent psychotherapy, and this is this fantastic psychodynamic model that really sort of chips away at either if a parent has experienced ongoing trauma and is now struggling to raise their child because they never got the attachment stuff and they never got that self-regulation, and so they don't know how to teach their child. But also, if you have a child that has been exposed to something traumatic, it's a way to utilize that attachment with the parent to heal that for the individual. And then the newest one that is being offered in Portland, but has been deeply researched, is the traumatic stress intervention for children and families. And this is a very short term, right after a traumatic event or right after a disclosure, 4 to 6 sessions to at least help the family, prevent them from having some of those accidental maladaptive responses to what's going on for that child, immediately address the symptoms. So if they're not willing to engage in something larger, or it feels overwhelming, but there's been a death or a murder or a disclosure of abuse or something like that, this is a really effective treatment. So they exist, they're here. You may not remember that when you're sitting with a patient that comes across your desk in 3 months, 6 months, or what have you. But they exist and they're here for you. So if nothing else, as you're going out into this field, just holding the trauma lens, just thinking about not what's wrong with this child or even what's wrong with this parent, but what's happened to them that got them to the place where they just didn't have the skills they needed, will help you have a different interaction and will help that interaction be much more effective. Knowing what your community resources are, when there are signs, asking questions, taking care of yourself, and that sort of compassion fatigue of, God, I've seen this. You know, boy, I've been there. It happens in every profession. There's this moment where you're like, I don't know if I've got it today. Taking care of yourself to avoid that and reduce that, and being patient and compassionate. We're here for questions. I know a lot of you have to leave, but even before you leave, if anybody has any questions, we're here to answer them and go into more depth during the next half hour.